international educational webinar about the discussing what this technology can offer you. So welcome to everybody, and I'm going to move to the next slide. So let me introduce myself. I'm Dr. Marini. I'm the Medical and Scientific Director of the Skin Doctor Center in beautiful northern Italy, Trieste. I have quite a lot of experience in the field of dermatologic and laser surgery. I wrote a lot and presented a lot all over the world. I'm the founder president of the European Society for Laser Dermatology and also a co-founder of the European Society for Aesthetic and Cosmetic Dermatology, which I'm proud to serve even now as a treasurer. Currently, I'm the chairman of the Task Force for Laser and Energy-Based Devices for the European Academy of Dermatology. So let's move on to discuss Ellipse, the Candela company now. So Ellipse has been on the market for many, many years, and the lost treasure of this fantastic Danish company is called Nordlys. Nordlys is a platform, very versatile platform. It's a very compact, ergonomic, you can move wherever you want, it's a workhorse, and you can use on the same platform a vast array of multiple dedicated SWT, which means selective wavelength technology, IPL handpieces. You can use a powerful 1064 long pulse laser, or you can use also a non-ablative fractional 1550 erbium glass laser. So you are able to cover quite a lot of problems in the dermatological fields. So summarizing, this nice piece of equipment here offer you advanced short and long pulse selective wavelength technology. I'm going to discuss with you what short wavelength selective wavelength technology means in a few seconds. Extreme versatility of treatments, perfect ergonomic solution, and in a busy office, this is what you want. You want a compact system able to be moved from room to room without any complaint by the nurses because the system is too big or it's too heavy. Unsurpassed technology reliability, and this is due to the fact that Ellipse has been there in advanced research in the field of intense pulse light since many, many, many years, and they were able to master the spectral band delivery to the tissue. Smooth user platform interaction. This is another must for a system. If this interaction is good, you're going to use it. You're going to have fun in using. If the interaction is not, it's quite complex, and you're not able to get from the system easily what you want, then you're not going to use it very often because you kind of go where the system is or other system that's provided better interface, better user system interface. Fast and easy operational learning curve. This is very, very fast. And I can tell you that my nurses, they just love it. In one day, they were able to get the system working with satisfaction. Let's move on. Another slide. So who was the inventor of this technology? This gentleman here. This is Shimon Eckhaus, who developed the first IPL in 1991. It was a brilliant idea in an era where all, laser light treatment were based on lasers. So he said, I can use a flash lamp, and I can use different spectra bands. And these are some of the original, working station called photoderm. At that time, the filtering was not very effective. And sometimes, we got some side effects, and the system sometimes were called photo burn. So let's move on the next slide, and let's talk about what a non-coherent intense polychromatic light consists of. It's a xenon flash lamp. A xenon flash lamp is like the flash lamp you use as an example from with your camera. So you have an emission, simultaneous emission of multiple different wavelengths. Different photons strike, the potential target at the same time, but in different array. So you are able to provide a spectral band which is going from 500 to 1000 nanometer. And if you fire, this is a free going, it's a free delivery. So, but this could be too much. So we need to filter. We need to limit the number of photons we use according to the target we want to interact with. So we move to the next slide, and I'm going to explain you what a single filter intense polychromatic pulse system looks like. So we have a CNOS flash lamp, we have the emission, we have the possibility to work with filters that can move up and down according to the filter you're using, and you're able to allow the pass through these filter only of selected photons. All the others are blocked by the filter. So if you are, for example, willing to treat darker skin type, you want to limit the access to the skin of photons that are very well absorbed by melanin. So you use a filter to block this kind of photon and allow all the other photons to go through. So this is the principle of a single filter IPL system. You are, of course, controlling just one end of the spectral emission. And I'm going to show you in the next slide schematically what happens. So we have a reflective surface here. In the lamp, we have the CNOS flash lamp, the CNOS flash lamp fire, and all these represent different photons of different wavelengths. They bounce back from the reflective surface. They go through the filters, to the filter. Some of them are trapped in the filter, and all the rest go through the chill gel through the skin. What happens in the dual filter intense polychromatic pulse system? We have a primary cutoff filter we discussed before, and then we have a secondary filter it's always able to cut the tail of the intense pulse light emission. So we are able to control much better the spectral band, dimension, if you allow me to say so, and they are much more selective and much better, and you have a much better intense pulse light tissue interaction. So again, we have a reflective surface, we have a CNOS flash lamp firing. Photons are reflected by this surface, and they are concentrated, they are redirected down to the secondary optical filter, and so we have the possibility to trap photons with a cutoff primary and block other photons from the secondary. So you are restricting the spectral band, which is a nice advantage. Let's compare the two systems. So this is a conventional intense pulse light. You can see the absorption by the major chromophores that we can encounter in the skin. So this is hemoglobin, this is melanin, and this is water. This is a warning sign. It tells you that if you overheat, if you give enough photons to heat water, you are losing your selectivity. So you are still able to use a conventional IPL, but at the same time you are warming water too much. So you need to be very careful. You can burn the patient. In the selective wavelength technology provided by the ellipse candela, then you have a filter that prevents the photons which are widely absorbed by water to interact with water. So you are able to concentrate in the spectral bands which are absolutely selective for the target you want to hit. This is the array of multiple handpieces that you can operate with a fantastic system of ellipse candela. So you can see we have a dual filtering system. We have the primary filter that cut all the wavelength which are below 645, and then we have a secondary filter, in this case, that blocks all the wavelength that goes beyond 950. So the spectrum band you're working to remove hair from dark skin type is this one. So you're on the safe side. If you go for the photorejuvenation and vascular lesion in a phototype 1, 2, then you can use this spectrum band. So cutting 530 and cutting all the wavelength beyond 750, you concentrate your effect in this kind of spectrum band. Okay, are all the IPL system available on the market the same? Yes, the technology, I mean the flash lamp is there, but the technology which is able to control the emission is different. So, and this was a very interesting paper published some years ago by my friend Godfrey Town, 2007. He went not to the companies, he went to visit the clinics where the IPL were installed and measured the emission of all the different IPL systems, and he found out that the emission was quite different. So every system is different. You need to know your system. You need to select the best system for your practice. Again, concerning the safety, is the IPL system, is the IPL technology safe? According to this paper published recently in Laser Medical Science, Laser and Intense Pulse Light Association is safe for concerning cancer lesions. So no worries about it. Now, what are the chromophores we work with? Hemoglobins, which is a fast dynamic chromophore because hemoglobin is moving in the blood vessels and it doesn't stay still. So it's a fast dynamic. The target is different from the chromophore. The target is a vessel wall and collagen. Melanin is slow dynamic because it's produced by melanocytes. So we are interacted with a melanosome, and melanocytes. And of course, where are the melanosomes? In the keratinocytes. The melanosomes can be also in the melanocytes, the melanocytes themselves. And of course, in case we want to do the epilation, permanent hair reduction, we use the hair germinal cells as a target, using the melanin as a Troy horse to capture our light. Water is almost static because it's everywhere, so all cells contain water, and our target is collagen. The exogenous pigment, almost static, it's tattoo, microparticles, fibroblasts, monocytes, but be careful. Don't treat tattoos with this technology, with the ellipse technology, because the pulse duration, even the wavelength is correct, is absorbed correctly, is too long. So the thermal damage you provide to these small pigment particles is too much. So you have the possibility to develop scars. So never treat tattoos with this technology. Using this different system, Nd:YAG, 1550, Erbium-YAG, and IPL, you can address vascular targets, pigmentary targets, structural dermal, hypodermal targets through controlled photothermal coagulation, controlled photothermal destruction, and progressive photothermal remodeling. So we have all the tools to do what we want to obtain. Let's see some example with pigment-specific targets. It goes without saying that a dark skin responds different from light skin, because dark skin contains much more melanosomes. And so we need to use a filter which is cutting off most of the wavelength which are absorbed superficially by the melanosomes. And so to be safe, we need to play with filters. We also can play with the energy and maybe the pulse duration. Light skin contains less melanosomes, so much more transparent. You can practically go with any kind of wavelength through this kind of optical, favorable penetration of the skin type 1, 2. Okay. This is a review article that tells you that we have highest level of evidence to treat lentiginous disease, melasma, poikiloderma eschevat, but I like to warn you about melasma because even if you treat melasma with intense pulse light, and this, according to this article, it's the evidence is level 1B. Be careful because the melasma is not a static target. It's not a static, let's say, issue. It may come back, and it will come back. So you need to use IPL with caution and along with other kind of strategies. Saying the patient, we do our best to control what the melasma, not to treat and raise the melasma forever. IPL irradiation rejuvenates the skin collagen via bidirectional regulation of matrix metalloproteinases, transforming growth factors beta and mitogen activated protein kinases. These are our targets that tells us that using this technology we are able to rejuvenate the skin, to renovate the skin through production of new collagen. And this is a photo rejuvenation image gently provided by Suzanne Kilmer, and you can see she used this is a phototype 1-2 patient, so she can tolerate this kind of spectral band going from 530 on, and these are the parameters, and you can see the clinical results after 2 treatments. Look at the porous reduction, look at the uniformity of the pigmentation. So this is an ideal treatment for rejuvenation. Epidermolysis, solar lentigos. Of course, solar lentigos respond very well. There is an increased number of melanocytes in solar lentigos, so we can decrease the number of melanocytes with this technology. Isolated cafe au lait macule can also respond well, but they tend to recur. So careful, not promise the patient a complete removal. This is the typical end results of a solar lentigo treated with the Q-switch nanosecond or picosecond laser. This is the final result, but you can see that quite a heavy, let's say, discoloration immediately after, and this discoloration, this inflammatory, let's say, complication usually lasts for 4, 5, 7 days, and patients are not that happy. They need to be informed. You can use IPL in a different way. This is just using a small, handpiece, a small filter. You can stack, the pulses one on top of the other, and without having the reaction we shared with you before, you can eliminate very gentle the solar lentiginous. Let's go on. So chromophore melanin, you can use this kind of spectral band. This is a filter using also for the photodynamic treatment. This is phototype 1-2 skin, and this is for darker skin type. You can really have the possibility to treat all the lesions with this. What happened to the typical lesions that we want to address, the pigmented, like a solar lentiginous? Immediately post-treatment, they get darker. So you inform the patient because we are oxidizing the melanin. So, and then we have a peripheral heat diffusion. So besides get darker, they are a little bit redder at the periphery and a little bit swollen. So large lesions accumulate and release more heat, so they are more swollen. So you need to tell this to the patient so they are happy to enjoy a uneventful post-treatment recovery time. Mild tingling sensation, which is due to the fact that the epidermal barrier has been kind of disturbed for 30 minutes to 1 hour. So this is a pretty normal series of events after this. And you can see this is a nice series of pictures provided by my friend Peter Bering. You can see the oxidation of the melanin on the surface due to the IPL. Okay, so no worries. This is normal, sign. This is dermatomyositis chrono aging. You can see this is IPL photofacial treatment, just IPL, nice results with this. In case you want to be faster, you can use photopeel, which is the combination of intense pulse light and immediately after a TCA, very low concentration TCA, 15%. This is the nice result we were able to attain after 2 sessions. And this is the typical sequence of events. This is preparation. Even if we said that IPL is kind of safe, we prefer to protect visible moles with a white sticker, and we show this to the patient that this is for medical legal reasons. They understand we care and we are cautious. Then this is immediately post IPL. This is immediately post 15% TCA. You can see the whitish frosting, and this is 60 days post treatment, 1 session. So nice combination treatment with IPL. Another case. Of course, when we deal with different anatomic areas, the healing time is different. The face heals faster than the décolleté. So you need to discuss with patients. The results are the same. Nice results after photopeel. On the hands, fantastic results. And even with time, you can see these hands were treated with the photopeel, and this is after 2 years. Look at the quality of the skin, and we were able to keep the situation quite under control. So melasma, okay, these are fantastic results due to the combination of IPL followed by the new cysteamine bleaching cream provided and produced in Switzerland. We got a fantastic, this is not hydroquinone based, it's not toxic to the cells, and we were able to get this fantastic result with the combination of the 2 technologies. Hirsutin's hypertrichosis, fantastic result with the proper filter. And one more thing, it's a fast technique because the recharging of the capacitors of the new system of the Nordlys is very fast. So a treatment like this can last few minutes. So, and it's very effective. Let's go on. Vascular specific target. In this case, in rosacea patients or essential telangiectasia, I prefer to use the 1064 to do the vessel hunting. You can always, on top of that, in the same session, use the IPL to do the finishing. And you have this is a rosacea patients that suffer from telangiectatic, matting and capillary venular dilation. The first pass is non-pulse 1064. Then we do the following pass with the vascular pulse, the vascular filter IPL, and this is the end result. And you can see after 1 session, you can see, look at the quality of the skin after this combined session. Another case. And in patients that, male patients particularly, and also in some female patients, if they start suffering from a fematous reaction in the nose, we also provide low-dose oral isotretinoin. When I talk about low-dose oral isotretinoin, I'm talking about homeopathic dose, 20 milligrams per week, 20 milligrams twice a week maximum. And this combination of IPL and this low-dose isotretinoin work wonders for rosacea patients. Another case. Other cases. Acne. Fantastic treatment for acne. In case we have acne, which are patients with a lot of protoporphyrin 9 fluorescence, natural fluorescence in the sebaceous glands, and we can measure with a fluoroscope before the treatment, we use this kind of spectrum band, which is 400 to 720. I call this a natural PDT pass, followed by a vascular pass and a TCA. Why I use the vascular pass? Because every time we do with the first pass with something, the skin is not the same. The skin is a little bit inflamed, so we have a little vasodilation. So the skin is different after the first pass. We have more, let's say, hemoglobin pigments, and we use this kind of spectral band to take maximum advantage of the thermal effects of this spectral band on the dermal layers. Another case, acne photo peel session, fantastic result about this combination. Keratosis pilaris rubra facie, difficult. We can combine 1064 and pulse dye laser and IPL, and we got fantastic result. Now, with the short pulse provided by the new Nordlys, which is 0.5 millisecond, you don't need the 595 PDL anymore. You can use the short pulse, 0.5 milliseconds or 1.5 millisecond, providing the same results. Resistant pore stain, we use this as a patient that came to our attention after 13 non-specified laser procedure in Romania. You can imagine how the patient live her life with this kind of defect on the face. So she asked for help. So we did a combination treatment using Nd:YAG for blebs. Then we used a 595 pulse dye laser. Then we used the 1550 non-ablative fractional and erbium YAG or a CO2 fractional in the same session. This is a fantastic, really fantastic results. Skin remodeling. Look at the skin remodeling you can obtain with this. 30 days post-op using a combination of non-ablative fractional resurfacing and, of course, the IPL and chemical peel. When it comes to acne scars, my technique is, and these are difficult areas because the skin is very thin, we use a subcision to lift up the skin. We use a subdermal hyaluronic acid immediately after as a bio booster, and we use the 1550 to remodel the skin after that. And this is the end result you can obtain. Okay, let's go on. This is the sequence: no block, infiltration anesthesia, subcision with 18 gauge knuckle needle. Then of course we eliminate the bleeding and we control the bleeding. Then we immediately use the 1550 erbium glass to stimulate the collagen on top, and then we inject the filler, subdermal distribution filler, as a bio booster. Stretch marks combination treatment, fantastic. 1064 to warm the skin, then 1550 to let's say remodel the skin and produce new collagen, and light chemical peel. This is what we can obtain with this kind of results, with this kind of combination. Post-traumatic hypertrophic scars are excellent. You can use the 0.5, 1.5 vascular handpiece of the IPL, similar to what we used to use to select when we were using the pulse dye laser, and followed by the 1550 nanometer non-ablative fractional, and this is what you can obtain. So, in conclusion, present trend among patients willing to improve their cosmetic aspect confirms their propensity towards less invasive, less painful, preferably short downtime procedure. Future forecast do confirm a further increase in patient demand for more gentle yet clinically effective procedure. Non-ablative lasers and IPL are really at the forefront of technical advances, aiming at meeting patients' desire and expectations, and through the technology provided by Nordlys, Nordlys, you are going to be really on the forefront. Laser and IPL pulse modulation, along with innovative combination strategy, as we discussed before in my presentation, seems to be the most successful strategy for the next decades. And with this, I conclude, and I thank you for your kind attention, and thank you for joining the Ellipse Candela educational webinar. Thank you.